So it's a
Sound
late topic, and we have tried to cover the whole of the is टॉपिक के जो भी एरियाज हैं वो कवर करने की कोशिश की है, मगर होपफुली कि आपको कुछ समझ में आ जाएगा इंशाल्लाह कि better to understand the guide wires, catheters, and DJ stand and their qualities, indication and contraindication, and their complication, and in the last the indication of lithotripsy, contraindication, and the working of lithotripsy. And in last, the newer advancement in the lithotripsy, that was, we have added 2 slides and 1 article. So let's start.
Assalamu alaikum. I am Dr. Uzma Hamid, and our presentation topic is Basics of Endourology. My moderator is Dr. Mazhar. He is from Sakkar. Contents that we are going to cover are guide wires, glide wires, dilators, catheters, double J stents, and extracorporeal shock wave therapy, lithotripsy. Guide wire classified based on following properties: size, tip design, surface coating, shaft rigidity. And ideal guide wire should have a certain diameter. It should be straight, flexible tip, and Teflon coated stainless steel. Almost everyone must know indications of use of guide wire during endourological procedures. Mostly we go with guide wire first, and if there is need or difficult negotiation, then we use glide wire. Basis of size, guide wires are available in various length and diameter. Diameter varies from 0.018 to 0.038 inches, and length is from 145 to 150 centimeter depending on height. And diameter most commonly used is 0.038 inches. On the basis of tip design, guide wire must have a reliable atraumatic path up the ureter. So ureter anatomy and pathological process dictate which tip is most capable of achieving and maintaining urethral access. Straight tip, angle tip, length of floppy tip varies from 1 to 3 centimeter. You can acknowledge here the J-tip design of wire, guide wire, and angled wire and straight. J-tips are beneficial in preventing urethral perforation because the leading edge of the wire is an elbow, which is less traumatic than the relative sharp end of straight wire. They are especially useful in patients who have impacted urethral calculi or urethral tortuosities. And it is also used in PCNL. Shaft rigidity. Inner core wire, solid stainless steel, usually made of nitinol, which is nickel titanium, which provides strength, stability, and kink resistance. Character of wire. Outer core is formed by tightly wrapped around the inner core, and it provides smooth passage of the instrument. It is coiled. The outer part is coiled, and it is radio opaque. And you can also see flat shaping of ribbon-like shaping. Surface coating. Purpose of surface coating is to reduce friction and also low coefficient of friction to negotiate up to ureter. Materials used, mostly the material which is used is polytetrafluoroethane, which is Teflon, or it could be hydrophilic coating like polymers, and it can absorb water to produce non-frictionless surface. Various colors are also used in coating. Like you can see in this, the end is color coded. Glide wires. Outer polyurethane layer is coated with a hydrophilic polymer and especially slippery. The first thing that comes to our mind when we think of glide wire is their slippery property, which is the cause of indication in most cases. Coating mostly with polyurethane for smooth surface and tungsten, which adds radio opacity. Hydrophilic material, same as guide wire, which cause water to stick on surface to make it smooth and slippery. Advantage of glide wire is useful in negotiating around impacted urethral stones, tortuous ureter, strictures, smooth coating so wire does not kink. So only disadvantage is not reliable for safety as there is tendency to slide out of patient. Sir, would you like to add something or should I continue?
Yes, this topic is again one of those topics that are very dear to me, just because of the reason that, to my own reckoning, this is something which is a technological advancement, and if this would be in place and possible, the new era of modern urology wouldn't be on the horizon. So, with the advent of all these guide wires and the hydrophilic coatings, what happened was the frictionless surface was available, and this friction is actually the harbinger of something called nidus for stone formation, or for any infection to just have a nucleus and then propagate from then on. So you see, whenever you enter any tubal structure in the body, whether you are working in GI or whether you are working here in in urology, you got to have a guide, and the guide is a guide wire. So this guide wire has given an impetus to a lot of different fields in medicine, including cardiovascular, including urology. And as I have said, you need to have a guide in order to have a kind of a pilot that takes you around certain areas, anatomical areas, which are slightly bent, which are slightly curved, and then move on to the target position. So these wires are very important, and to understand the importance of these wires, you've got to know the tip as well as the end, which is the far end. So the tip and the far end, they are different. They are different in design. They are different in coating, perhaps. And for instance, if you flip something which is a J tip, floppy end, to a stiff end, then it will cause a lot of damage. It will cause dissection, which is like submucosal dissection. So understanding the guide wire is the main thing, which is the first step towards going, which we call endourology. So if you want to delve into the subject of endourology, you've got to know your wires, you've got to know the caliber of wires, you've got to know the length of wires and the coatings. Unless and until you have the knowledge of all 3 or 4 characteristics of a guide wire, you will not be able to properly have a result out of your procedure, whatever that procedure may be. It might be a simple procedure of DJ stent placement, or it might be a procedure like ECIRS. So it depends upon a guide wire.
So it's a very long topic. We are supposed to cover guide wire, dilators, catheter, and ESWL as well. So we will proceed. We have already covered guide wire and glide wire.
Sir,
Now,
sir,
moving
just we are knowing the importance of the J tape and also the straight and the coating, surface coating. Please show the slide. Sir, what is the importance of the color of this wire?
I mean, I don't know what is the importance of color in order just to have a kind of a differentiation for a person who is not a technical person, or when you work in an inventory, for instance, in a storeroom of maybe an operation theater. So there are many people who are not medics, who might be paramedics. So for them, these color codings are actually aided tools for differentiation of different things. So they do not denote something which is very important unless and until you go into the details of something written on the envelope. What is the length of the wire? What is the caliber of the wire? Which means the cross sectional diameter of the wire and the coating. These are the 3 main things on which you have to place your technical caliber. You see, if you want to be a surgeon in urology, working in endourology, you got to feel yourself as somebody who is a technician. If you are not a technician, you will not be able to appreciate the kind of the dynamics. Maybe it's a mechanical dynamics, or maybe it's a fluid dynamics. Both these things are very important. If you don't understand the relationship between pressure and flow, meaning to say you don't understand the relationship of flow dynamics or fluid dynamics, you will be ending into something called perinephric collection or periurethral collection if you go into the upper tract. So there are certain things which are beyond your capacity of knowing biology. If you are entering biology, which means you are entering anatomy as a surgeon, with a kind of an instrument that is a technological advancement of something which is through engineering, you are actually an engineer or a technician doing something with energy sources and appliances. So you got to increase your capacity to know how these things are working in terms of like maybe physics. So that has to be at the back of your hand, interest in physics.
Thank you.
अगर आप लोग आगे आ जाएं तो ज़्यादा आसानी रहेगी बात करने.
Coming to dilators, there are mainly 3 types of dilators that we are going to cover. Alkane metallic dilators. Mostly we have seen this being used in PCNL procedure. They are coaxial dilator system. Can anyone tell me what coaxial means here? They are called coaxial for a reason, because they are advanced over one another and they are not taken out after one. So there is importance of it, and it causes hollow guide rod starting from 8 FR, and it dilates each by 4 FR. Tract dilation up to 26 FR. Advantage is that it is rigidity of the system, dilatation of dense scar tissue. And disadvantage is that it can cause iatrogenic injuries due to difficulty in controlling pressure during dilatation and stabilization of the guide rod. And it is advanced over a locking end rod, which can be seen in this radiographic image. And this rod looks like this, a ball at the tip, and then it is advanced over it. Coming to Amplitz dilator, it is plastic polyurethane dilator. Introduced catheter acts as a guide for dilators up to 12 FR to 32 FR. Introducer sheet allows safety wire placement, and its length is 30 centimeter, which is quite deep. And dilators are passed one after the other, not coaxially, like alkane dilators. Advantage is that it is radio opaque and short tapered tips, smooth surface, decreased trauma. And disadvantage, it can cause hemorrhage. Time can occur each time when dilator is drawn out, which is more expensive, and also it is disposable, so it can't be used again. And also there are balloon dilator catheters with preload sheets. I haven't seen it using in urological procedures here, but these are also used in endovascular procedures and cardiac procedures. When moving on to catheters, their indications are quite clear in our mind, that they are either being used for drainage, therapeutic use, or diagnostic studies. So first, ureteric catheter which is made of polyethylene with radio opaque coating and a lure lock, which is or simple adapter, which is provided at the end, and it is also used for diagnostic purpose, for contrast injection or sample for taking sample. Its indication are either in retrograde pyelogram, fluoroscopic studies, collecting urine from cytological examination or culture, brush biopsies, and procedures that require urethral catheterization, including draining and obstructing kidney, or for DJ placement. Any example of any procedure in which we use urethral catheter, like they are saying for draining and of obstructive kidney, that comes to your mind? Please make it interactive, because this is a long presentation. and going to get boring as well. Obstructed case, we apply ureter first and ureteric first, and then we can advance DJ over it. And its properties are it is made of PVC with hydrogel coating, and it is also radio opaque. Sizes from 3 to 8. Mostly we use 5 to 6 FR, and length of 70 centimeter. Indwelling time should not exceed for more than 24 hours.
Yes, and two more properties. For instance, again, this ureteric catheter has got a very long length, probably I think 45 centimeter. Manu, aap agar correct kare mujhe. And it has got a different kind of design of the tip as well as of the other end, that is the far end. The tip is actually a conical shape, and this conical shape is actually the end which you should introduce first, and that makes you understandable that it will engage the ureteric orifice since it is a conical shape, and then you must proceed it onwards. Now, not in this country, but perhaps in other countries, or perhaps in our center also, we have got different dimensions of these catheters, and they are precisely used for dilatation of ureters. So, but we might use it for interim catheterization, not as a dilator in many of our cases. So you see, there are many gadgets in your hand, and when you are a surgeon and you are working on a patient, it depends how you design yourself. One is the design of the instrument, and the other is the design of your procedure. So how you design your procedure, what kind of instruments you want to use first, second, third, in order to achieve one goal. So in that, the books are giving you a kind of a sketch and outline that the first step is this one, the second step is this one, the third is this one. But there are certain areas, certain instances when the pathology is actually guiding you or telling you or asking you to do something out of the box. So it doesn't mean out of the box that you use something in local anesthesia, but you do within the parameters of certain rules and guides, but you can use your instrument to the best possible knowledge and to the best use of the advancement of technology that is being available to you. So here, different caliber of ureteric catheters are available. And when you need something called urethral dilatation, for instance, if the ureter is a tuberculous ureter and it needs DJ stent placement for a longer time, so uroradiologist is the one who uses these kind of ureteric catheters to dilate the ureter.
On the basis of tip design, it can be of various types. Some of them we have seen here, and let's cover it. Open end catheter, they are mostly used for performing pylography in our setup. Whistle tip catheter, it is oblique, whistle-like shape at the end, and it is also used for retrograde urethrogram. We can there are pigtail ureters, ureteric catheter, which is single curl at the kidney end, and this can be kept as a self-retaining catheters like this one and this pigtail. And close end catheters, this always comes with a stillet, and it has a round blunt tip and 2 holes on the side. We can pass glide wire from the holes as well.
And this is sorry, I just want to interrupt at this point, because if the far end, the end which is going inside the body is closed, now this ureteric catheter is specifically for dilatation. It is not for draining, because it will not drain. There are no side holes, and there is no hole at the very end of the catheter. So this is only for interim purpose of dilatation. The other catheter, which has got a kind of a pigtail, now that is a self-retaining kind of a catheter. So it's you say a prototype of a DJ stent with one DJ, meaning say with one curl, the other curl is not there. So these catheters have got their tips, and these tips are for purpose. So they are not without any purpose. Again, it depends upon you how you use them, whether you know them, you know your instrument, you know your devices or not. It depends upon you. So nobody would tell you कि आपने करना इस तरह है. ये आपने खुद सोचना है. यहाँ से आपकी अपनी free thinking start होती है as a surgeon. So urology and any surgical field has got a point when you do your post-graduation, perhaps, when you start thinking to the best use of instrument so that you can gain something for the patient.
So you can see angle tip catheter. This is mostly used in awkward ureteric positions, like kink in the ureter, where there is difficulty in negotiation. Double J stent, ideal double J stent should have a high tensile strength, allows large internal diameter relative to the external, because they are mostly used for drainage purpose, and high retention coil strength, because it should maintain memory and position so that coil remains there. Excellent biocompatibility and biodurability, because it has to stay up to some months. And excellent radio opacity confirmation of procedure, and varying durometry, soft to be tolerated and stiff to be placed and drained. Low surface friction aid in placement. Usually it is coated with Teflon, PTFE, and hydrophilic polymers. Complications that are early, we all know, is hematuria. It could be due to hematuria, infection, kinking, fever, inflammation, or trigonal irritation. And late complications that can be seen is stent migration, biofilm formation, missed or forgotten stent, which can act as an idus for stone formation as well, leading to obstruction. Yes. Then moving to urethral catheters, Foley catheter, mostly we use simple. It can be of simple catheters, non-indwelling, or self-retaining catheters. In simple catheters, it could be of rubber or Nelaton catheter, metallic catheter, Tiemann catheter, or the ones that we leave behind, self-retaining, Foley, Gibson, Malicot, and pigtail catheter. Almost all of us has seen some of them, but these are used for percutaneous drainage.
It's not Gibson, it's Gibbons.
Then for percutaneous drainage, we have circle nephrostomy tube. This is something that is taken from book, and I haven't seen this used, but obviously the purpose is quite clear for drainage. And Malicot drain and catheter with urethral extensions. This is also used for drainage purpose. And Cope's catheter, all of them are used for percutaneous drainage or later on for pylography. And this is a Cope catheter is the one with a string loose attached to it. And this string later on helps in retaining percutaneous drain for
right. So when I was a resident in my first year, and Dr. Munawar was also there, we used to have this Malicot catheter available to us for suprapubic placement whenever a person comes to us with a lot of clots in the bladder and perhaps bladder growth. So those were the days when there was no oncology clinic, no oncological service as such, but they were oncological patients. So we used to treat them with, if we place suprapubic catheter, the catheter will block. So these kind of Malicot catheter, they have got a very wide bore. They can drain the clots as well as they are self-retaining, meaning to say there is no balloon, but there is a kind of a star-shaped figure. If you want to remove it, it's very easy. You have to place the left hand on the abdomen of the patient and just pull it. Pull it with a continuous force of your right hand. It will come out, because when you pull it, it flattens. This star-shaped structure flattens. So it is nothing but just a rubber star shape.
For Cope's catheter, you are supposed to pull it a little and cut the thread, and then it can come out easily, like a regular catheter. Classification of catheters on the basis of size. On a French scale, 1 FR to 0.33 mm, or channel, it could be 2 ways or 3 ways catheter on the basis of tip design and material color coding. So we are going to cover this quickly. Based on material, it can be of latex, silicone, latex, PVC, Teflon, hydro, gel coated, or antibiotic impregnated. All of them have different indications. Catheter selection in
सॉरी एक
yes.
प्रीवियस स्लाइड एक आपके पास ना समझे कि एक एमसीक्यू आता है व्हाट्स द डिफरेंस द मेन डिफरेंस बिटवीन पीटीएफई कोटेड एंड हाइड्रोजेल कोटेड द मेन डिफरेंस बिटवीन द टू आप अंडा तो खाते होंगे ना अंडा फ्राई किस पे करते हैं हाँ नहीं फ्राई किस चीज पे करते हुए फ्राई पैन पे ना फ्राई पैन किस चीज पे कोट होता है पीटीएफई कोटेड it's a non-stick,
Yes, sir.
which means it's hydrophobic, right? ये हाइड्रोजेल जो है ये हाइड्रोफिलिक है. So phobic and philic क्या मतलब हुआ?
In phobic, the water doesn't get attached to it, and the other way around for the hydrogel, the water will get.
Yeah. So hydrogel coating is a special kind of a coating, which when is exposed to any kind of a fluid, which might be urine or which might be water, it gets absorbed. It becomes a jelly. It decreases the coefficient of friction. Meaning to say, आप उसको हाथ लगाएंगे आपको लगेगा जैसे जेली लगी हुई है. So ये हुआ हाइड्रोजेल कोटिंग, ठीक है. So ये जो चीज है ना ये तो हुआ हाइड्रोफिलिक. जो दूसरी वाली चीज है पीटीएफई, इट इज हाइड्रोफिलिक. तो वो आपके सरफेस के ऊपर जो है ना वो आने देता है पानी को, लेकिन एब्जॉर्ब भी नहीं करता और ना ही वो स्वेल अप होता है. सो वो भी फ्रिक्शनलेस है. दोनों फ्रिक्शनलेस हैं बट द फिनोमेना आर डिफरेंट. सो द क्वेश्चन वुड बी आस्क्ड टू एनीबॉडी कि व्हाट्स द डिफरेंस इफ बोथ ऑफ देम आर फ्रिक्शनलेस, बोथ ऑफ देम आर डिक्रीजिंग द कोएफिशिएंट ऑफ फ्रिक्शन, व्हाट्स टेक्निकली डिफरेंट. आप ये नहीं कहेंगे सर इट यू मस्ट आस्क DuPont, which is the company behind PTFE origination. ये तो आपको पता होना चाहिए. तो ये मैं कह रहा हूँ आपको हर वो चीज पता होना चाहिए जो आप यूज कर रहे हैं. आपने कहा कि जी मुझे एक गाइड वायर दो जो कि हाइड्रोफिलिक कोटेड हो. वो कहे जी कौन सी गाइड वायर, यहाँ तो चल जाएगा. इसलिए टेक्नीशियन यहाँ का बेचारा कुछ नहीं जानता ना, आप लोग उसको जानने देना भी नहीं चाहते. इंग्लैंड में तो वो पूछेगा आपको जो है ना वो किस लिए गाइड वायर चाहिए. आप कहेंगे जी मुझे सिलिकॉन गाइड वायर चाहिए विद पीटीएफई कोटिंग. कहेंगे नहीं फॉर व्हाट पर्पस. ये सारे सवाल के जवाब आपको वहां देने पड़ेंगे.
Desired drainage can be accomplished with 12 to 14 FR for clear urine. For pus or hematuria, it should be 20 to 20 FR. Different types of catheter. Like Foley catheter, it is normally coated with color, and FR are almost everybody knows about it. And there is a balloon at the end of it, which helps in keeping it in the bladder.
So 1 FR equals to what? 0.33 what?
Millimeter.
ठीक.
This is what I just told.
लगता है अब आपको लोगों को ना पढ़ाना पड़ेगा डंडे के तौर पे. यही मैं ही करूंगा.
Robinson catheter is catheter which is made of red rubber for single use for emptying bladder. It has 2 eyelets, 2 opening eye, which provides high flow of urine, and it is radio opaque due to lead oxide content. It is available in 8 to 12 FR, and catheter is used in declining as red rubber is irritant to the urothelium. So it is only used for drainage purpose, that procedure.
And there is a difference between red rubber and latex rubber. So you have now a catheter which is not a red rubber catheter. Foley's catheter जो आप use करते हैं ना, it is a latex rubber catheter. So आपको ये पूछा जाएगा कि what's the difference? आप तो ये इस्तेमाल करते आ रहे थे. तो around 1970s ये एकदम से Foley's catheter क्यों आया? Just because the reason that red rubber catheter has got a kind of a property which increases friction, which increases encrustation, which increases infection. So it was replaced with another coating, and that coating is latex. ठीक है, आगे बात मजीद तफसील से बाद में करेंगे.
Cord catheters are often prescribed to individuals who have difficulty inserting a regular straight catheter into their urethra due to urethral strictures, high bladder neck, or prominent median lobe of prostate. For CIC purpose, it can be used, but it can also be used in those patients with difficult catheterization. Cord word is used for the tip of the
It's
catheter.
Coude. It's
Sorry.
not good.
Counsel catheter allows for wire-guided placement through an end-hole drainage port lumen at the tip of the catheter. This provides a direct route for the wire from the drainage port through the lumen of the catheter for advancements of catheter over the wire. Counsel catheter, I haven't seen it used in here.
नहीं है, मौजूद है यहाँ पे. सारे आपको कैथेटर्स मिल जाएंगे, कम से कम उसके स्पेसिमेंस मिल जाएंगे. और मेरी ये गुजारिश होगी, जो लोग इम्तिहान में जब भी जा रहे हैं इनको एक नज़र देखते जाइए. जब इंस्ट्रूमेंट्स देख रहे हैं तो कहिएगा थिएटर स्टाफ से, आपको वो दिखा देगा. So you should know the history and the historical catheters also. Gibbon.
Complications, we already know: hematuria, urethral or meatal strictures, urethral perforations, allergic reaction including anaphylaxis, stone formation, just 46 to 53%, bladder neck and urethral erosions, and stuck folds. Coming to the next.
Excuse me. We usually use the water for the inflation of the Foley's during the insertion. So most of the resident, if present, doesn't know about it, that you have to use the water for the inflation of the Foley bulb, not the normal saline, because the normal saline has properties of crystallization, and once it's crystallized, then the bulb of the Foley was stuck, and it could not be deflated and could not be retrieved from the bladder. So you have to use the sterile water for the inflation of the Foley of the bulb.
Coming to ESWL, which is shockwave lithotripsy, as the name suggests, extracorporeal. So in this case, it uses weak, non-intrusive waves generated externally, transmitted through the body, focused on the stone. The shock waves build to sufficient strength only at the target force for fragmentation of stone. To summarize it, we need to know the physics behind ESWL machine as well. So they are differentiated on the types of some certain characters. Like in the machine, how it works, we need to know the wave, and there has to be a generating device in each one of them, and it is transmitted through a medium. So there has to be a medium for transmission of the wave, and it has to be through a medium which is transmitter, and then the focus point, the place from where the wave generates, it's called F1 point, and then there is a reflector, which is mirror, and on the basis of difference of mirror, there are different types of devices.